Hello and welcome to The Conversation with me, Amanda de Cadenet. Today we have the renowned and absolutely brilliant neuroscientist and author, Dr. Lisa Mosconi. She's joining us to discuss a topic that affects all women but is often extremely stigmatized, and that is menopause. In this episode, we're exploring the future of menopause treatment and how to embrace this emotionally transcendent time with confidence. Additionally, Dr. Mosconi will share insights from her brand new, groundbreaking new study on the impact of estrogen on the female brain. Please enjoy this incredibly hopeful conversation that will help you to see menopause not as an ending, but as a powerful new beginning. Let's get to it. Dr. Lisa Mosconi, welcome to The Conversation. Good morning. How are you?
I am very good. Thank you. Very happy to be here and to meet you.
I'm really looking forward to talking to you.
Great. Let's do it. Also, is this going to come out after June 20th?
Yes.
Yay. I have a surprise.
Oh, good. Okay, good. We can talk about it.
So we have a big announcement on June 20th. Our new study is going to be published that day. And it's basically the first time ever in history that anyone has ever been able to measure estrogen activity in the brain.
Wow.
It's never been possible before.
Congratulations.
Thank you. I am so excited. This study is 5 years of my life. I started in 2019 because I do all this work in menopause and women's brains, and estrogen is so important for women's brain health. And I have a PhD in neuroscience and nuclear medicine. I do brain imaging for a living. That's all I do. And so I went to my radiochemistry department and I said, I need to measure estrogen in the brain. What are my options? And they said, 0 options. We do not have this methodology. And I was like, that is unacceptable. So we need to. And so we did. And next week, the very first study comes out. Is the very first picture of estrogen inside a woman's brain. Can you believe?
Are you so excited to share those results?
Yes.
Yeah, I'll bet you are. I'm not going to ask you what the results are because we're going to wait for your study to come out.
Mm-hmm.
But is it information that will be game-changing for women who are navigating this stage of life?
I think so. I believe so. It's the first time that we actually understand or see how estrogen works inside the brain.
Mm-hmm.
And our study obviously is focused on women. And
Thank you.
Yes, that's why we're doing it. But it's actually a method that can be used for any brain and anything else. Like I want to study puberty. I want to look at pregnancy. I want to look at everything that's impacted by changes in estrogen concentration, right? Birth control, hormone replacement therapy.
Well, as you talk about in your book, the 3 Ps, puberty, pregnancy, and perimenopause. And those are 3 stages of life, which, every female is going to experience. And yet there's so little research about actually what happens to us. We're just thrown into these cycles and not knowing why we're having these responses. I've been interviewing women for 20 years. As your work has been focused on women, so has mine. And I've interviewed so many women at all different stages of life, which I love. I speak to women who are 18 and women who are in their 70s. And not one woman has ever mentioned perimenopause or menopause. It's almost like it's been a dirty word that people have not wanted to admit to. Why the silence?
I think it's a combination of ageism and sexism that really compound into menopauseism. And it really, in my assessment, is almost 100% cultural, because it's our culture that says to us that as women, our only value lies in our ability to bear children. And once we're no longer able to do so, or reproductively viable is a terrible word to use, but once we're past that window, then our value progressively decreases with age. We're not attractive anymore. We're not useful anymore. We're just not worth it. And I think this is an extremely damaging way to think about women as half of the population. And I noticed that in my practice as well and in my research, then we talk to women about their menopause and perimenopause and just menstrual cycles all the time at this point, besides their brains. And there's no sense of achievement associated with menopause. Everybody's worried about it. Some people are really scared about it. And so we talk about solutions and how to make it better. But there's this idea that menopause is something you have to fight, it's something to avoid altogether, or that you have to overcome. There's no sense of that being a part of a woman's life. That, yes, it comes with challenges for sure, but what doesn't? I honestly, just having a menstrual cycle is no picnic. Postpartum periods are not easy to overcome, if you will. Menopause is part of a woman's life, and I think the more research we have, the more science we have, the more we'll be able to offset whatever cultural message we've been given around menopause and really look at facts and information, and we can understand the biology and the physiology and the neurology of menopause, and then eventually come to just consider that as part of being a woman, right?
Yeah, it's interesting. I agree with you about the cultural stigma that has gone towards this feeling of women not wanting to admit that they are in this cycle. And even me, as someone who has spoken so openly about many experiences to do with being a woman and difficult things, I even had a consciousness of, oh, once I start talking about this publicly, it lets people know that I'm of a certain age. And I thought, wow, if I'm feeling like this, what are other women feeling like? And not only that, but how do we change the cultural stigma? Because even with research, even with information, even with education, there is still a cultural power that values women primarily for their desirability, which is connected to their fertility.
And that's something that comes up a lot in psychology, neuropsychology. When we talk about menopause, we ask them about upsides, right? The downsides of menopause are obvious. There are the hot flashes and eye sweats. There's maybe depressive symptoms, the brain fog. But what could be the upsides? And one thing that comes up almost all the time is that women feel more in charge of making their own decisions and speaking their own minds. And there's this thing called emotional transcendence.
Ooh, I love that word,
Yeah, well,
emotional transcendence.
it's emotional transcendence, or as many of our patients put it, giving fewer F words.
Yeah, yeah.
They've really
You can say that
skyrocketed.
word on this podcast.
I don't usually swear in English, in Italian.
You can do it in Italian. I would love
I
that.
did. But it really comes up a lot when I started researching menopause, because I'm trained in Western medicine and whatnot. I was looking at everything that could go wrong with menopause. The medical definition of menopause is a state of hypogonadism resulting from estrogen deficiency, resulting from ovarian failure.
Wow,
If
just the
that's your
language.
framework,
Yeah.
yes, if that's your framework, you're doomed. And how do we make you feel better?
Mhm.
But then by looking at a different type of research, evolutionary biology, genetics, anthropology, I realized that the picture is much more complex and that our thinking is really rooted in culture rather than biology. And so I started looking at the upsides of menopause and this rewiring that takes place inside their brains. That, yes, it comes with some glitches and with the symptoms and some risks that do need to be addressed. Nobody should discount any of that. But there's also a reason for those changes to take place.
Right.
And
Our
if,
bodies are smart and they're wise. And so
yes,
this is not happening in a vacuum.
yes,
What are those reasons?
So there are different reasons. From the brain's perspective, I think what really helps is to think of menopause not just as a reproductive event, but also as a brain event. Because if you are a brain, ever since you got through puberty, you have to be able to initiate a number of things that prompt menstruation every month, that enables the woman to get pregnant if she chooses to be pregnant, right? And that is extremely expensive neurologically because it takes a massive amount of neurons. And neurons are really hard to maintain, metabolically speaking. So the brain is the hungriest organ in the
That's right.
body,
Yeah.
except the vast majority of energy and resources. As you go through menopause as a woman, all those connections, all these neuronal pathways that enable menstruation, pregnancy, postpartum, raising a child, all that can go. So if you are a brain, it makes sense that you start shedding neurons. You want to get leaner and meaner, if you will.
But you don't get, well, you can get a bit meaner. I've been getting a little meaner, but I understand this from an anthropological perspective. But when you say you're shedding, what's the outcome of that?
One objective is to get rid of the neurons and the connections that you no longer need. That's really good for your brain because a smaller but better connected brain is a healthier brain, is a more resilient brain. Now, that process, that rewiring, has some pros and some cons. The cons is that we get symptoms, like the hot flashes, the night sweats, the sleep issues, and the mood changes, and the brain fog. Those are the things that we would like to avoid. But the pros are also very interesting, I believe, because there's this remodeling, and we need more research on that for sure.
I like that language, remodeling.
Yes.
Your brain is remodeling.
Yeah. Menopause is a renovation project on the brain. It's a biological clue for your brain to start changing and rewiring, because this rewiring is going to help you transition to the next phase of life that is no longer reproductive, but remains markedly productive.
Are you sure that my brain is going to be able to handle anything productive at this point?
I am confident.
Okay.
I have a lot of confidence in your brain.
Okay, good.
Yeah.
I mean, it's interesting. Our brains are the most vital organ, and yet culturally, we pay such little attention to its health.
Oh, yeah, absolutely. Actually, we consistently discredit women's brains. We give our brains no credit for all the things that they're doing for us throughout life. We're always making fun of women who are having PMS, right? Or, oh, she's having a hard day, she must be hormonal, or maybe it's menopause, but it's always in a derogatory way.
Yes.
And I love my brain. I'm so grateful for everything that it allowed me to do. And I'm also very mindful of the things that I can do to support my brain health. We have some control over our brain health, the same way that we can support the health of the rest of the body, not just in terms of fitness, but really overall health.
Well, I think that education piece is really interesting because I can just speak from my perspective that because so few people have been speaking about this, about a year ago, when I started experiencing what was happening to me, I thought I was going crazy, to be honest. And I have two friends. Both of them said, "Have you had your labs done?" And I said, "Yes, they are fine." And actually, both of them said, "That doesn't matter with what you're describing. The experiences that you're having, it sounds like you're in perimenopause." And thank God that I had two women that I knew of, that I'm fortunate enough to have access to, who could help educate me. But I felt like, and it's interesting because I was saying to people, I have not felt like this since I was a teenager, since I was 15, 14 years old. And that obviously was when I was in puberty. And I started making a connection without even knowing what was going on with me. It was like, have I ever felt like this before? And it was when I was a teenager. And thank God that I got some support from those women to sort of understand a little more what was going on with me. But even with education, it still seems like it's not a one size fits all. It's so much trial and error. I certainly have a brain fog that makes it hard to interview people. I'll be in the middle of an interview and I'll forget someone's name. No, it's awful. It's awful.
It's the reason that most women come to us for research and for prevention. It's really one, there are three things that come up all the time. One, they're scared of losing their minds. The other one is fear of developing early onset Alzheimer's, fear of dementia. Sometimes the brain fog is so severe that so many women will come to us and say, I need to be screened. I need to be tested. Because
That's what I have. And my mom has dementia, and I have one of the APOE4 genes.
Mm-hmm.
So,
so I think it's a legitimate concern for sure.
Mm-hmm.
And the third thing is I don't feel like myself anymore.
It's
One of these three things. It's really so common, and I think it's so unfair to women that whatever we know about menopause is really only half of what menopause is all about. We're always only talking about menopause as a reproductive event. It's only about whether or not you have a menstrual cycle. Sometimes someone throws a hot flash in there, but there's so much more to menopause. And what's really most disruptive to most women is the brain fog.
Oh, I'm so grateful to hear you say that.
Right. Look, it's 2/3 of all women. So what we do in this case, you come to us, or someone who's worried comes to us, and we do a ton of tests, all FDA-approved tests. But the most important things, the most helpful things, are cognitive testing and brain imaging. I can tell you the relief that so many of our participants experience. Let's say that 5 years ago, 10 years ago, on this test that goes from 0 to 30, the mini mental state examination is one of the most commonly used tests for global cognition. You hit 30, which is very common for women. Most women score really high on cognitive testing.
Of course we do.
Of course, exactly. Now that you're going through menopause, you are a 28, right? So it's a 2-point change out of 30. For you, that is unbearable.
Yeah.
Because as a highly functioning individual who's always really performed at their best, just this measurable 2-point decline feels like you're losing your mind.
Yeah.
But effectively, you're perfectly within normal range relative to other women of your same age and educational level. We always Z-score for age and education. And that typically is a huge relief. So this is actually, menopause is not Alzheimer's disease.
And that information is so important, so you don't feel alone and you don't feel like you are losing your mind and that something more serious is going on. How many women opt out at this stage of life because they just don't know what's going on and how to help themselves? I would imagine that there's a significant drop of women, maybe in certain industries or business, where they just can't do it.
Yes, menopause in the workplace, and how, especially in England, I hear a lot of women just can't work.
Yeah.
They have significant challenges to just get through the day. And that I think is terrible. Also because we have solutions. We just don't really talk about these solutions. And there's so much bias against hormone therapy, for instance, for menopause. And there's so much bias around seeking help for menopausal symptoms. And I think that's really terrible, and it needs to change. So I think what needs to change here is a couple of things. Number one, we need research. And let me tell you, I'm a brain scientist. There aren't that many brain scientists
I know.
who do menopause. Right.
And I'm curious, what prompted you to do this research? You are an anomaly, and I'm so grateful for the work that you're doing. I just want to say thank you.
My pleasure. It's been hard, actually. I've been a scientist for most of my life. My parents are nuclear physicists, and I started being around scanners and cyclotrons when I was maybe 3 years old. I remember my mom would go to the CERN in Switzerland, in Geneva, to run the huge accelerator that they have. And so I really grew into science. And when I was doing my PhD, my grandmother developed dementia. She was diagnosed later on with Alzheimer's disease. And so did her two sisters.
Wow.
As their brother was spared. And they all lived to the same age. So for me, it was devastating. My grandmother having dementia was really devastating. My mom was beyond herself. And she was like, I am going to do everything I can to avoid this outcome. And I said, me too, obviously. And so I started studying that for my PhD. And I was asking, does it matter if you're a woman or a man? I mean, we've known since 1994 that after getting older, after aging itself, being a woman is the most significant risk factor for Alzheimer's disease. And my question was, why? And why are we not doing something about it?
Because it affects women.
Because it affects women, of course. But mostly they would say, because it's aging. It's just aging. It's not menopause. It's not being a woman. It's just aging. The point back then was that Alzheimer's disease is a disease of old age, and women live longer than men. So at the end of the day, more women than men have Alzheimer's disease. And actually, to clarify, it's not just my family in the United States of America, but globally, almost 2/3 of all Alzheimer's patients are women.
Wow.
Which means that for every 3 patients with Alzheimer's, 2 are women. This discrepancy or disparity has been completely overlooked in medicine until really, really recently, when myself and other scientists have shown that Alzheimer's is actually not a disease of old age. Alzheimer's is a disease of midlife with symptoms that occur in old age. Alzheimer's disease is a process, and it starts with negative changes in your brain years, if not decades, before the diagnosis of Alzheimer's disease.
And can you see that on imaging?
Yes, that's what we're doing now. So this technology became available in 2007, 2008. So we immediately started using it. And what we showed is that if you look at men and women in midlife, the women will start showing signs of Alzheimer's plaques in their brains as they go through menopause, perimenopause, more so after. The men do not. So this timeline is different for women than for men.
And why is that?
Because we think that it's because estrogen is a neuroprotective hormone. So sex hormones are mistakenly labeled as sex hormones. This happened in the 1930s when scientists who were studying reproduction discovered estrogen, progesterone, testosterone, and they said, oh, great, these are sex hormones. You need them for fertility. You need them to have kids. And we've been stuck with that definition ever since, because it wasn't until 1994 that brain scientists realized that those same exact hormones are actually brain hormones. They're not just important for having children, they're just as important for having healthy brains.
Interesting. Have you scanned your own brain?
Yeah.
How did you feel looking at it? Especially with the history of Alzheimer's and dementia in your family.
It's a little tricky. You cannot be part of your own research. So if I did it, I would not be able to use my data. So what I would do is that I would go somewhere else.
I see.
Then I don't have as much access
To the tools that you have.
Yeah, I'm trying to work with them, and I'm positive I will. I told them for my birthday.
For your birthday. Oh, I love that. For your birthday, you're going to give yourself a gift of a brain scan. That's a fantastic gift. So your practice is research. The average woman, could she come and sign up for your research program, or do you see patients who are not in the research program? How does it work?
Yes. So I'm the founder and director of the Alzheimer's Prevention Program at Weill Cornell Medicine, NewYork-Presbyterian. And the program includes 3 different units. We have the Women's Brain Initiative, which is my baby, my academic baby. So it's a clinical research program where we do the brain estrogen imaging, we develop molecular tools. It's more research-based. But then we also have a clinical trials unit where we do clinical trials of Alzheimer's prevention that are specifically helpful to women. And then we have the Alzheimer's Prevention Clinic, which is an actual clinic that you can go to for risk reduction of Alzheimer's disease. So if someone is interested more in getting a baseline evaluation, then I would suggest doing the research because it's done at no cost to you. And we share all the results that we can share, that make sense to share. If someone is instead really worried about Alzheimer's disease and they want to engage in prevention, they can either go to the clinic or do both. And for those who have hot flashes and brain fog and sleep issues, we have clinical trials of designer estrogens.
Okay. Yes, I want to talk to you about that in a minute. So, well, really, we need these clinics in every city.
Yes, I think so. When I took over the Alzheimer's prevention clinic, I modified their scope of work a bit to be more specifically looking at gender. So we're now working with the OBGYN department for women who are going through menopause. We work with endocrinology. We work with preventative cardiology. We have a lot of physicians and specialists involved where we provide the neurological component, the radiological component. We do the imaging, we do the blood work, but then we triage with other specialists because it's the whole body that is involved.
Yeah, it's treating the whole person, which is not the traditional Western approach, is it? It's isolating and treating symptoms, not looking at the root. And in this case, the whole woman.
Yes, we follow an integrative medicine approach. And I'm very fortunate that my chairman, Dr. Fink, allows me to do that. Cornell is very conservative. It's a very conservative institution, but they're really invested in women's health, which is what drew me to them and the other way around. So I'm very fortunate that when I went to my chair and I said, I want to start the Women's Brain Initiative, he first looked at me like I had two heads. Wait a minute. But then he let me explain and he was like, you know what? If you can pull it off, let's do it.
Wow. Thank God for the male allies, right?
Yes. And that's what I've been experiencing more and more is that there's a lot of men who really want in. They want to help, they understand the challenge. They love their wives, they love their girlfriends, they love their daughters, they love their mothers. And they understand that there's something that is taking their loves away from them in a way.
Yeah.
When you're suffering, you're not yourself. It's not just you. People who love you also feel it. So obviously they want to help. We have some of our major donors are men.
That's just so encouraging to hear. If you love a woman, it affects you. I can't believe I have such little information. So I'm very proactive with sharing it with my community. You've probably heard about probiotics and the importance of a healthy gut microbiome. Well, I've got some news for you. Over 15 years of research on the vaginal microbiome have revealed that our gut isn't the only part of our body that thrives on an optimal microbiome. For years, Seed has been my go-to for improving my family's gut health, so I'm excited that Seed has launched VSO1 Vaginal Symbiotic. Your period, exercise, diet, sex, this can all mess with your vaginal microbiome, making it sensitive to imbalances and unwanted, uncomfortable issues. And I don't need to tell you that there's nothing worse than feeling like something is off with your vagina. That's why I'm so into Seed's VSO1. It's the first vaginal probiotic suppository designed to nourish your vagina with the essential biome it needs to flourish. I've read the research and I've interviewed the scientists behind VSO1, and I've decided to give my vagina the attention she deserves. If you want to check it out, please go to seed.com/Amanda C and use 25 Amanda C for 25% off your first month supply of Seed. So let's talk about solutions because there's a lot of questions that people have. Obviously, the main one, which you've heard so many times, which is the misinformation around HRT. And I think it would be really helpful for you to clarify for my listeners what the facts are around HRT and who is a candidate and who isn't.
20 years ago, there was one study that failed. That study used different hormones than we use today at very high doses. And the study even started before anyone had any clue that estrogen had an impact on brain health, right? It started in 1993, and we found out that estrogen was important for brain health in 1996. So the investigators back then, this is the Women's Health Initiative, just did not have all the information that they needed to design this study in a way that was conducive to success. So let's just not talk about that study anymore.
Great.
We have different hormones. Yeah, please. We're done. I'm so done.
Yeah, I'll bet.
Yes. We have so many more studies that have been done since with different hormones, different routes, different formulations. And generally, hormone therapy, the way we do it now, is considered safe for most women. Now, the tricky part is this. Professional societies did not change their guidelines and recommendations until 2022.
Wow.
Yes. So if you work in this space, you do have to follow the guidelines. Up until 2022, they recommended to only use hormone therapy if strictly necessary at the lowest possible dose and for the shortest possible amount of time. And there was also a very long list of exclusions. Today, as of July of 2022, there's been quite a makeover and the remodeling in the way we think about HRT. And today it is understood that most healthy women younger than 60, within 10 years of their final menstrual period, can safely take hormone therapy for relief of menopausal symptoms, whether estrogen alone, estradiol alone, or estradiol and a progesterone.
And the difference between estrogen and estradiol is one is bioidentical. Is that correct?
So estrogen is an umbrella term for many different types of hormones. The most powerful one is called estradiol, 17-beta estradiol. Estrone, there estriol, there are different forms that are not as abundant. And estradiol is the master regulator of women's brain health. It's such a potent hormone that neuroscientists believe that it's really like an orchestra conductor in women's brains, and you kind of need it to make sure that everything works.
Are the hormones in HRT, are they all bioidentical now?
No.
Why would someone take non-bioidentical hormones?
It depends on what you want to achieve. There are some combination of hormones that will tackle more things than just estradiol alone. And there's also some people believe after menopause, estradiol goes down, but another type of estrogen called estrone is actually increasing. It's like a backup type of estrogen.
It's the backup battery.
Yes. And people say, well, let me give you more estrone, for instance, or let me play with different hormonal formulations. One type of estrogen that's been used for many, many years is called CEEs, conjugated equine estrogens, that are predominantly estrone, but there's a lot of different types.
It's interesting because a lot of people work with hormones, and I'm hearing from many of my friends, and experienced it myself, that it's not, the person has to be so educated about how to work with them that even when women are on HRT, they're still not getting the relief that they could have because of the lack of experience and knowledge that even the practitioners who are using HRT have.
Yes, and that's really because of lack of research.
Well, if you're saying it was 2022 when the FDA changed their guidelines, this is only 2 years ago.
I'm always like, why has this not been done yet? And we get a lot of pushback, for instance, when we say that estradiol is a neuroprotective hormone. I mean, we've known this forever. Really,
and when you say neuroprotective, what do you mean?
It really supports brain health. It's a hormone. It supports neuroplasticity, which is the brain's ability to switch connections around and find alternate pathways and just maintain neuronal density. It supports brain energy levels. It literally tells your neurons to burn glucose or fat or protein faster to make energy, primarily glucose. It is an anti-inflammatory and an antioxidant hormone. It supports blood flow to your brain. And that's really incredibly important for nutrition, for oxygenation, for rejuvenation, for clearance, and also protects against pathology and insults. So for instance, in animal models of Alzheimer's disease, when estrogen levels are high, the likelihood of developing Alzheimer's plaques is low. But when you have an animal model of menopause, basically when you remove the ovaries of these animals, then they start developing the plaques.
So who should not take HRT?
I think what's important to realize is that women who have cancer, estrogen receptor positive cancer, or women who have had estrogen receptor positive cancer or just an estrogen susceptible cancer are not at present candidates for the types of hormones that we have available. And that is important to know. What is also important to know is that having a family history of breast cancer does not disqualify you. It's only if you have had cancer yourself. And I find that a lot of women are very confused about this, and so maybe their providers, because again, the guidelines changed fairly recently. That we had one participant in our studies, they went to her and said, "You have to stop taking HRT because her sister developed breast cancer."
Hmm.
And she was like, "But I don't have breast cancer." And they're like, "Well, just to be safe." This is not according to guidelines. If you yourself don't have breast cancer, you are eligible for hormones. And then again, the guidelines are a little bit fuzzy when it comes to cardiovascular disease or obesity. A lot of women with a history of cardiovascular disease and blood clots, women who are heavily overweight are usually not offered HRT. These are hard exclusions, as is liver disease. Which is why we are working on the next generation of hormones that is hopefully going to be available to all women with minimal to hopefully no side effects. And these are called designer estrogens.
Yes, let's talk about them.
Yes, those are very important. I really think they're going to be the future in menopause care because these are selective estrogen receptor modulators or
SERM, SERM, right? I read about them.
Yes, the SERMs. And they are specifically engineered to go straight up to your brain to support energy function and cellular energy while having neutral or inhibitory effects on breast cell and endometrial cell proliferation, which means they do not increase your risk of cancer to reproductive organs. They may actually reduce it. And there's a whole number of scientists working on that. While at the same time powering your brain, which is what you want, reducing the symptoms of menopause.
So how long from getting the results of your clinical trials that information will be released, right?
If everything goes well, hopefully just a couple of years.
So it will be a couple of years from finishing a clinical study until you can get FDA approval on this SERM treatment.
Yes.
Mm. So I do have some girlfriends who are choosing to not do HRT because they were particularly sensitive to any kinds of hormones or the contraceptive pill, and they did not do well on that. And so when they're taking HRT, they're not feeling great. And so I'd like to talk about what the alternative options are for people and how effective are they?
Mm-hmm. Well, it depends for what.
For menopausal symptoms.
Which?
The hot flashes, the brain fog.
Yes.
Those are the two that I know that my friends who are not taking it are trying to address.
So right now, most options we have are targeting hot flashes. It's not approved for brain fog. So I can share my personal experience with brain fog.
Yes,
not
please.
that I have it, but clinically. But for hot flashes, so for vasomotor symptoms of menopause, during menopause, if you are not eligible or hormone therapy doesn't work for you, you'd rather not take any hormones, which is totally fine. Other options include some antidepressants. Paroxetine is a good one. seems to help with the hot flashes. There's a new medication that just came out. It's called fezolinetant, or the commercial name is Veoza. That is a neurokinin 3 inhibitor. So it basically works on the hypothalamus, which is this part of your brain that is responsible for regulating body temperature. And it's a non-hormonal pathway that still gets to the hypothalamus in a way that calms it down. And it's been shown in clinical, obviously it's FDA approved, so it's been shown in clinical trials to significantly reduce the number and severity of hot flashes. Then there are things like gabapentin that sometimes help, clonidine sometimes help. The Menopause Society recommends highly cognitive behavioral therapy and clinical hypnosis.
Oh, hypnosis. Interesting. For what?
Yeah, for hot flashes.
Wow.
Yes, cognitive behavioral therapy and clinical hypnosis. And then we have lifestyle modifications, from diet and exercise to stress reduction and sleep hygiene and avoiding environmental toxins. These are all things that have been shown to correlate with fewer hot flashes and milder overall hot flashes.
And what about for the brain health and the low energy?
There's nothing that is FDA approved for that. We are obviously testing hormone therapy for that. We just published a meta-analysis, which is a statistical integration of everything available, every clinical trial that's ever done, looking at hormone therapy for support of cognitive performance, which means brain fog, right? When focus, attention, memory retention. And overall, if you look at all the studies combined, estrogen therapy is associated with improvement in some cognitive functions. So this is something that is not yet FDA approved, but I think it's really worth doing more research on, because again, brain fog is 2/3 about women, perimenopausal and postmenopausal. So this is something important to know. And it seems to work especially well for women who go through menopause because of surgery.
Yes, I read that in your book.
So women who undergo surgical menopause because of an oophorectomy, which is the surgical removal of the ovaries, those are at higher risk for osteoporosis, for heart disease, perhaps cognitive impairment. So in that case, estrogen therapy is recommended by professional societies. They do advise to start therapy as close as possible to the time of surgery and keep taking hormones until the natural age of menopause, which is about 51, 52. If you can't take hormones, then we're back to non-hormonal options.
But it sounds like there isn't a lot of options for brain fog that is non-hormonal. I mean, I know exercise, diet, sleep
Yes.
hygiene. Something I've noticed with myself is I probably had sort of low-grade ADD my whole life, but I never needed medication, and I functioned at a pretty high level until I hit perimenopause, and all of a sudden,
Yes.
I would absolutely fit the criteria for having ADD at this
Yes.
point.
That's such a good point. And it comes up a lot. I think what the research has shown, and other people's research has shown, is that menopause, perimenopause especially, is a little bit like an activator for whatever medical risks you have. So let's say that you have a predisposition to ADD or ADHD or depression or anxiety or perhaps Alzheimer's disease. Those risks tend to become actual symptoms or signs or red flags as you go through menopause. It brings it up because your brain is in a transition, and it's basically when your brain is at its most vulnerable in some ways, because the superpower of hormones and progesterone are gone, and the brain is kind of rewiring to find a new normal and carry on. But the transition is intense. If you're a brain and you have to rewire and switch to new mechanisms to get energy and whatnot, right? You're busy. And then something may sneak in, and it makes you more susceptible, more sensitive, perhaps, to things that may affect you. So there are so many women who experience depression for the first time in their lives as they go through menopause. there are women who develop anxiety for the first time, or if you had it in the past and you were doing fine, it may come back as you go through menopause.
It is so unfortunate that you've made it to your 50s. You've worked so hard with your career. You're in a partnership and you've got kids who are probably at this stage leaving, going to college or starting their lives. And you're like, right, this is some time I can actually focus on myself and connect with what I want to do and what I'm passionate about. And then it is a full-time job taking care of your brain.
Can be. There are some women who really breeze through menopause, although most women feel the impact.
Yeah, I ask women now, have you gone through menopause? Some women I know who are like, oh, yeah, it was totally fine. And other women who are just like, oh, no, I can't leave my house. You know?
Yes, there's definitely a range. I joke with my daughter that by the time she's going to hit puberty, I'm going to be in perimenopause.
No, it's so interesting because my husband, he has me in perimenopause and a teenage daughter. And he's
Exactly.
like, wow, this is a lot.
Yeah, that's why men want to be involved.
Yes.
Because in the end, they're part of it and they want to help.
Yeah, and to understand what's going on.
My husband knows everything about menopause and puberty and pregnancy at this point. And he talks to his friends. He's a little older than me, and his friends are going through menopause at this point. And he's there counseling them and saying, no, it's not your skin. It's not your skin. It's your brain that gives you the hot flashes. I think it's great. What I said to him was, when I go through menopause, I want to party.
Oh my gosh.
Right?
How? Yes. And actually with the work you're doing, you probably will be able to.
I would love to have a party and celebrate because I think it's a huge milestone in
It
a woman's
is.
life. And the more comfortable you are with it, and I think mindset plays a role as well. And I would like to talk about this if you're okay with
Yes,
that.
please.
So the experience of menopause is not universal. So all women all over the planet experience the same hormonal changes, right? Estrogen goes down for everyone, progesterone goes down for everyone, testosterone gradually declines for everyone. But the actual experience is so different from continent to continent and country to country, where some women, some populations, some groups of women do not have symptoms.
Really?
Yes.
Who are those groups?
In Japan, until very recently, they didn't even have a word for menopause. They would call the experience, the transition, konenki, which means renewed energy.
Oh, beautiful.
Yes, in part because the women there don't suffer from debilitating symptoms. In fact, they don't really have that many hot flashes. More often than not, they have frozen shoulder, joint pain. In some parts of India, rural India, the most common complaint is that you can't see as well, that there's a decline in eyesight, but not the hot flashes. In some part in South America, there are no symptoms whatsoever, even though those women tend to go through menopause even earlier than we do, and more in their 40s. And they don't have symptoms. So what anthropologists have found and psychologists have found is that mindset, or the way you approach menopause culturally, seems to play a role. Because for women who have something to gain after menopause, like an increase in social status,
they're excited. They're like, bring it on.
And there seems to be an impact of whether or not you fear menopause, whether or not you dread it. So there's this phenomenon in medicine that everybody's familiar with, which is the placebo effect, right? Where if you think that something is going to be good for you, you'll feel better, even though maybe you're just having sugar or water. There's also the opposite effect. It's called the nocebo effect, which is very powerful. It's a strong confounder in clinical trials, where if you believe that something will harm you, you may feel harmed. You may experience the symptoms you're trying to avoid, even though you're not taking anything that may give you symptoms at all. So that, I think, is very important. And I personally, for me as a neuroscientist, I make a point of practicing mindfulness and I practice insight meditation pretty much daily. And I think it really helps me with the way that I navigate through life. When there's something that doesn't go my way, I still try to remain not positive necessarily. I'm a realist, but neutral.
Well, it's interesting that you're raising this perspective on mindset, because I've noticed that the women who I spoke to, who I don't want to say breeze through, but comparatively,
Yes.
are mostly from different cultures. They're not American. And I started to think about in Western culture, we indulge, people become obsessive about what's happening and they want to preempt everything, and they're obsessed with longevity, and it can go too far, right? Taking care of yourself can tip into obsession. And so I've really looked at that with menopause as well, because I didn't really know anything. And, and like I said, it is a full-time job, but also trying to create a space for a healthier outlook. There's one book that I read called Wise Power that is written by these Australian women. And it talks about menopause from a spiritual and anthropological standpoint. And it is the only book that talks about the purpose and the meaning of menopause in women's lives, not from a scientific standpoint. And it gave me so much comfort to understand that this is actually beneficial in ways. Women have been going through this for years. It's not for nothing.
Yes, yes. One thing that we never talk about that I think we should really appreciate is that most female animals die as they go through menopause, right? For most animal species, your lifespan coincides with your reproductive span. Not for women. And we are one of 4 animal species that were able to outlive menopause.
What are the other 3?
So, killer whales, which I love the idea. They're women and killer whales.
Yeah.
Another type of whale, I think, is the narwhals. One type of Asian elephant, one type of giraffe, and one bug, the Japanese aphid. It's really important to realize that if you're born with ovaries, that menopause is a fact of life. But in reality, it's really special. It's really unique to be able to live past it. And if you're a female, and at this point, most women live at least a third of their lives in a postmenopausal stage.
Well, that's the thing. We live so much longer today than we've ever lived.
Yeah. We have to make the most out of it. We want to protect our bodies and our brains. Midlife is a really important time in everybody's life. Basically, your health in midlife is the strongest predictor of your health in old age and for the rest of your life. So this is when we do need to think about self-care. And I find that so many women very generously put everybody else first.
Yes.
Your kids come first, your job comes first, your parents come first, your husband comes first, your friends come first, the gym comes first, your diet comes first. And your health is always taking the back seat. But this is the time to take care of ourselves. And I know it's really hard. I struggle with that. It's always the balancing act. But it is important to do it because menopause really drives a lot of outcomes.
Lisa, I think we need to start a ritual, which you mentioned, the menopause party.
Yes.
Why are we not creating a ritual for this?
Absolutely. I think we have to.
All right, let's do it.
I think our generation is the generation that's going to really make an impact and really change things because we are not scared.
No.
We are not afraid to speak up. We're tired being patronized, right? We don't need to be patted on the shoulder or on the head. We don't need to be sugar-coated. We can take it. We can take it. We can take menopause. We're given birth to
That's
children.
true.
We can take menopause. And I think this awareness is going to be extremely important for the next generations that will not see us miserable or suffering or withdrawing or becoming invisible.
That would be a tragedy that we become invisible at this crucial stage of life with the wisdom and the experience that we have. There's so much for us to offer.
Yes, absolutely. And if they see us empowered and taking care of ourselves, all the next generations are much more likely to be doing the same and just talk about things and be open about things and not, taking no BS, because we still get a lot of that.
When you meet women and they know what you do, you must be experiencing gratitude from those women.
Yes, it's been really, really wonderful. Just so many people have come up to us and just saying thank you.
This has been such a treat. Thank you so very much for spending your time to help to educate me and my listeners. I know that this is going to be an incredible episode for so many people, and I'm really grateful for your time. And thank you for the work that you're doing. I mean, honestly, when I found your work, I was just so overjoyed and so grateful. And I know that so many women have really had significant help and support from the work that you do, and they will continue to do so. So I'm very grateful. Thank you.
Thank you. Thank you for saying that. And it's very rare for a scientist to see our work have an impact on culture and on actual people's lives. And that is such a privilege. And I'm so, so glad that we can do it.
Thank you so much for listening to that fantastic episode. Please like, subscribe, and all that business. It does really help the podcast. And most importantly, come join me on Substack. Substack is where I'm showing the video of the entire episode that you just listened to. So find me on Substack if you want to dig in a bit deeper to the subjects that we talked about in this episode. See you there.